everyone. I just wanted to check in with you. Thank you very much for attending this Healthy CPS Survey Preparation webinar. We'll be getting started in just a couple minutes. So hang tight and we'll be getting started shortly. Thank you. All right. Hello, everyone. Thank you for joining us today for the Healthy CPS Survey Preparation webinar. My name is Kenneth Varner. I'm the Community Engagement Manager with Healthy Schools Campaign. I first wanted to give you a quick look through what to expect for today. The webinar will run for approximately an hour, maybe a little bit less. A recording of the webinar will be made available to you. In our follow-up email, I will be sending a link to that out. As well as you can share that with anyone. You can also direct people to the Healthy Schools Campaign website where we will have that up by next week. For those of you that are attending now and would like to take advantage of the CPDU that we're offering for 1 hour, you can download the handout that you should see on your control panel for this webinar. You can send that back to me and then I will send you a certificate of completion. Just so you know ahead of time, I will need your Illinois Educator Identification Number. It is something that ISB requires, so if you can send that to me as well, you will be getting my email later on in this presentation, and I'll be able to send you everything that you need to claim that 1 hour. Throughout the presentation, we will be asking you a couple poll questions, so please answer those as those appear on your screen. And then in a follow-up email, you'll also receive a survey that'll only take a couple seconds, about three questions. We just want to see how you felt about the presentation. So if you could take the time to do that, I would greatly appreciate it. And also, we'll be having some time for questions and answers at the end. You can ask your questions through the chat function that you'll also find in your control panel. So if you just send those through anytime you have a question, you don't have to wait until the last 10 minutes to ask a question. You can send it through at any point in time, and that's the designated time we will be going over those. So as they come to you, please go ahead and send them through. Today's speakers, we have myself, Kenneth Varner from Healthy Schools Campaign. We have Elizabeth Hansen from the Office of Student of Health and Wellness, as well as Sarita Shealy, also from the CPS's Office of Student Health and Wellness. To tell you a little bit more about myself, for those of you that I do not know or who may not know me, I'm Kenneth Varner. I have been working with Healthy Schools Campaign for just about 3 years. I work with our partner schools to help with the implementation of the district's wellness policies. Before working in this position, I was working at a school on the south side where I was a health coordinator. I was in charge of getting students to get their glasses, dental van visits, as well as helping just to create a healthier environment in the school. And I was doing that for about 4 or 5 years. So that's a little bit about myself. And what is Healthy Schools Campaign, for those of you that may not be aware? Healthy Schools Campaign is a local nonprofit that works on local, national issues around school health. We believe healthy students are better learners, and we work hard to make changes at the local, state, and national levels. We've worked with CPS to offer healthier school food and advocated for the return of recess. We've encouraged school districts to use green cleaning products, as well as hosted healthy cooking contests all across the city. We really focus on engaging administrators, staff, teachers, parents, and students to help encourage them to create healthier environments in their schools. So that's about Healthy Schools Campaign, but what do we mean when we say a healthy school? What is that? I like to think of it as a school that provides the wraparound services and creates that environment that addresses a student's non-academic barriers to learning, provides services such as dental and vision screenings and treatment, as well as mental health support. Basically, it's a school that considers the whole child when making decisions on how to best educate them. And the adults in that school don't just dictate to students on how to prioritize health, but also model that behavior. So when we're thinking about a healthy school, that is what we are referring to. If you want to learn more about how to create a healthier environment in your school, here's a few resources for you to check out. The top one you'll see is the Integrating Wellness into the CIWP. That is a great way to show your commitment to creating a healthier school environment, so you can include those goals in your continued your work plan for your school. So CPS has done a great job in creating policies to help create these healthy environments in the schools. If you are not familiar with these, I highly recommend that you give these a look over. The local school wellness policy has is how you create the general healthy environment. It covers all those things from physical activity to nutrition education to recess. The healthy snack and beverage policy dictates the food and drink that can be offered to students in the school building. Breakfast after the bell policy mandates that breakfast be made available to all students, even if they are late. And the physical education policy dictates the quality and the quantity of the PE that each student receives. So hopefully you are already familiar with these, but if not, please look through these, as why we are here today is to be prepared for the Healthy CPS Survey. And the Healthy CPS Survey is going to be the indicator of how well you've been implementing the policies. With that, I'm going to turn it over to our colleague, Liza Hansen from the Office of Student Health and Wellness. While I introduce the next speaker, I'm going to activate a poll question. You learned a lot about what Healthy Schools Campaign and who I am, but we want to know who is in the room, who's attending this webinar. So please let us know which title best describes your role in the school. Please select any or all that apply to you. All right, so let me introduce Liza. As a Healthy CPS specialist, Liza is part of the health information team, meaning she loves crunching numbers and using Excel. As a Chicago transplant from Wisconsin, she received her MPH in epidemiology from UIC. She is happy to be assisting the Office of Student Health and Wellness find data-driven solutions to improve health and wellness in CPS. So if you can all please click on what your response is. I will be closing the poll in just a moment. All right. I'll give you about another 12 seconds. So if you're an administrator, if you're a teacher, if you're a parent, community member, or you're part of a community organization that is partnered with a school, if you're a wellness team member, please let us know. That is something to keep in mind. All right, so right now it looks, just so my other colleagues know, it looks like half the people here are teachers, a good amount are wellness team members, and as well a good amount are administration as well. So thank you all very much for joining us today. It is greatly appreciated. And remember, if you have any questions, please send that through in the chat. And with that, I turn it over to Liza.
Hi, everyone. My name is Liza Hansen. I'm an analyst at the Office of Student Health and Wellness in CPS. So we're just going to give you some background on the Healthy CPS indicator before we get into the Healthy CPS survey itself. First, our mission and vision in the Office of Student Health and Wellness. We aim to eliminate health-related barriers to learning and advance child health equity in Chicago. We also hope that every child will have a medical home. So this is our organizational chart of our office and central office. Health promotion is the team that focuses on content-specific areas of health, including nutrition education, physical education, school food, school gardens, and chronic conditions. The team within the Office of Student Health and Wellness that Sarita and I are on is the health information team. So this means we develop strategized technical assistance. We develop the Healthy CPS survey. We also manage all of the data and the reporting of that data. So what is the Healthy CPS indicator? On the screen, you see two different images. These are two different possibilities of many that may represent your school's achievement on a yearly basis of the Healthy CPS indicator. You'll see that there are 4 different icons within each image. These are called badges. So we have the chronic disease badge, the instruction badge, the Learn Well badge, and the health services badge. The goal for each school is to receive a achieved status on the right side. So if you have any of these badges that are not lit up, that means that that entire badge was not achieved. The Healthy CPS indicator was designed to aid schools in meeting existing requirements in the school, to help them coordinate a comprehensive healthy school environment for students to learn, and to recognize your efforts for creating healthy school environments. Because, as Kenneth said, students learn better in healthy schools. Going specifically into the Healthy CPS badges, we have the chronic disease badge. The most prevalent chronic conditions in CPS are asthma, food allergies, and diabetes. So those are the 3 that we focus on in Healthy CPS. There are many ways that schools can support students with chronic disease, namely student identification, proper accommodations, such as allowing students to self-administer or carry their own medication that they've been prescribed, and staff training, so educating staff on being ready in case of an emergency related to chronic conditions.
As far as the instruction badge, this is where we take account of meeting the minute requirements and meeting the state mandates for education. So specifically speaking to nutrition education, physical education, and sexual health education. There is no minute requirement for nutrition education. We just want schools to make sure that they are implementing a systemic unit of instruction concerning nutrition education. For physical education, we want to make sure that schools are implementing 150 minutes per week for physical education, and we encourage schools to do so by breaking it down into 90 minutes of PE instruction and 60 minutes of health education instruction. And as far as sexual health education, all instructors are required to attend the sexual health education training to learn more about our curriculum and how it is inclusive of all students starting from grades K through 12. And the minute requirement is 300 minutes annually for grades K through 4 and 675 minutes for grades 5 through 12. And a lot of the information, if you are a CPS employee, can be found on the Knowledge Center, but we can also make sure that we can give you handouts and PDF about the overview and the scope and sequence for physical education, nutrition education, and sexual health education.
Okay, on to the Learn Well badge. This is the badge in which the most criteria reside, meaning it is probably the hardest badge to achieve considering there are more requirements associated with it. So this badge ensures student access to healthy foods and physical activity. So that can mean allowing students to have enough recess, giving them a healthy breakfast, integrating physical activity into the school day, creating a safe and supportive environment for LGBTQ students, utilizing garden space to the best of its ability, having fundraisers that focus on fun rather than food, as well as celebrations, and then not using food as a reward or punishment, and likewise not administering physical activity as punishment or taking it away. The Health Services badge.
So the Health Services badge is our fourth star, or third star on the indicator, sorry, but our fourth icon on the indicator, and this is where we want to make sure that we are providing direct access to healthcare services for our students that may impact their learning. So that encompasses health screenings, vision exams, dental exams, and making sure that our students meet the state required immunization and physical exam mandate, which is by October 15th. So we want to make sure that all of our schools are working with our dental providers and our vision providers to make sure that students receive the proper accommodations so that their learning is not impeded in any way. If you have any questions, we also want to make sure that we assist any families with acquiring health insurance or Medicaid information. So you can always call our hotline at 773-553-5437. That is also 773-553-KIDS. So it's very simple and easy.
So next, this is a snippet of one of our tools for schools to achieve Healthy CPS. This is our Healthy CPS checklist, which is really just a document that encompasses all the Healthy CPS requirements. It organizes it by badge and then within that by content area. So this is an excerpt of the instruction badge page of this checklist, which is available on the Knowledge Center. So this shows you that if you download the PDF onto your computer, it's an interactive PDF that allows you to look at each different requirement, apply it to your school, and click yes or no, which will, if no, will give you an action step on how to achieve that requirement. In tandem with the Healthy CPS checklist is the Healthy CPS action plan. So if you find a requirement when reviewing the checklist that you have not completed or needs work for the school year, that's something that you can put onto this action plan, associating potentially deadlines or lead people responsible for that item. This is just to help you plan things out for the school year so that you don't have to worry about it all at one time. And this is why, again, we encourage wellness teams incorporating a lot of people on this work and doing it on a periodic, steady basis throughout the school year. So now getting into Healthy CPS data. These are the Healthy CPS reports, which will be the final culmination of the data that we receive from the survey and other sources. So each school in the district receives a Healthy CPS report annually. It is a 3-page long document. So you can see here the front page shows the indicator status of a school, so really just the high-level summary of how well a school has done in the year. And within that, in the second 2 pages, are a badge-specific achievement. So there's a check mark if it has been achieved and X if it has not, and then there's a question mark for missing data. So in this instance, the school has achieved Healthy CPS, and we wanted to point out the scoring methodology, which is just that to achieve an entire badge, all 100% of the criteria, meaning the individual requirements listed under the badge, must be achieved. And likewise, all of the criteria, all 100% of them within the whole report, must be achieved in order for a school to achieve Healthy CPS. We did want to call out the fact that we are working on updating the design of the indicator to orient it a little bit more towards progress, including percentages, percentage achievement in each area. We'll have more on that later, but we just wanted to let you know about that. So in case you don't know how to access your school's Healthy CPS report or in other schools, you can visit the CPS website, search a school, go under the Downloads tab, scroll all the way to the bottom under the Other column, and then you'll see the Healthy CPS report from school year 17-18 as well as 16-17. The school progress report also includes the school's indicator status, not the entire Healthy CPS report, but again, that indicator status that we showed before. So, looking into Healthy CPS data sources, the Healthy CPS Survey is the primary source of data for the Healthy CPS indicator status of a school, but it is not the only one. So while we do rely primarily on the Healthy CPS Survey and your reporting to analyze your achievement at the school level, we also use administrative data from Impact or Aspen Learning Hub, and we also utilize the nomination form that you've all nominated your wellness champions and Medicaid designees on to evaluate whether or not your school is achieving Healthy CPS. Here's a Healthy CPS Survey timeline for this school year. So yesterday, the Healthy CPS Survey opened. All principals, wellness champions, and their relevant technical assistance liaisons should have received an email yesterday with the quarterly update of data, as well as the Healthy CPS Survey. The survey link is open until May 10th. However, if you complete the survey before May 1st, you'll be entered into a raffle for $500 for your school. By June 19th, all staff trainings must be complete, meaning each individual must have completed the ISB evaluation so that the status shows completed in their own My Learning and Learning Hub for those trainings listed on the screen. On July 8th, which is the week before the Summer Leadership Institute, we'll be issuing the draft Healthy CPS reports. At this point, we'll be accepting any potential corrections or responses from principals after their review of the reports until the end of the month. At that point, all analysis and communication will not continue, and the data will be finalized into final reports and data, and then later on uploaded to the school progress report. If you have any questions that we haven't answered or won't answer today, our information is here, Sarita and myself, and always our main office inbox email, oshw@cps.edu.
Thank you, Liza and Sarita. That was very informative. Thank you very much. I want to say publicly, I really appreciate you taking the time to do this webinar. I know sometimes dealing with people in schools, they can feel a bit overwhelmed, and it's nice to have this opportunity to actually answer a lot of questions, sometimes questions that people don't even know they had yet. So I really do appreciate you being here. So on behalf of everyone attending, thank you very much. So I want to go over a few things. Like I said, I partner with schools, and so there are some things I've learned as being on the ground in the schools that hopefully you will find useful. So I want to offer you some best practices. So what I'm going to go through is how to prepare for the survey that was released yesterday, the requested documentation that the survey is going to be asking for, and the key individuals that you should be speaking to get these questions answered correctly, exactly how you complete the survey. Then we're going to go over some lessons that I've learned from working with schools, and then reiterate those deadlines. So first thing you need to do is enlist one person to complete the survey. I've seen this a couple of times where you have different people working on the survey, and then different answers get inputted and someone changes the other answers. Just make sure there's one person at the top that all the answers get filtered through. So that can be the administration, that can be, typically it'll be like the wellness champion. So that person should be in charge of doing it. So what I would recommend is that the survey is going to be completed online, but I would recommend printing the survey, and that way you can distribute it to whoever you need to speak to answer those particular questions. But before you even do the survey, I would recommend reviewing the Healthy CPS checklist. Liza was just showing you a snippet of that, but before I go any further, I want to ask you a question. How many of you have completed your Healthy CPS checklist this year? So please let us know the answer to that. We just want to see how many people attending have done that. If you are unsure because you're probably new to the position, you just got told that you needed to be at this webinar, you don't really know why you're here, you can put unsure. That is completely fine. And just let us know. All right, I'm gonna give you another 10 seconds to do that. All right, thank you very much. Seems like a third of you have done it. The majority of you are unsure if it has been done in your school. So there is a link on your screen right now. There is this link where you can actually access the Healthy CPS checklist. So go through that with your wellness team, your wellness champion, excuse me, or your administration. And this will give you some insight into where you are in the implementation of the CPS wellness policies. And when you click yes or no, there's going to be the PDF will populate as into what your next action items are, what your next action steps are. Even if you click yes and you're confident that you have completed that criteria, please review what the action item is, even if you click yes to an answer. Because sometimes there's another step that you need to take just so that you'll be able to get credit for actually doing that thing. So please make sure that you look through that. So again, print a copy of the survey, and then you want to gather all of your documentation. So the supporting documents, one would be a nutrition education lesson, and Liza and Sarita, feel free to jump in at any point in time. So the nutrition education lesson will be a lesson plan that was actually distributed to students, and that was actually utilized by a teacher. So it's not going to be, the nutrition education thing, I'm going to go online, I'm going to Google something, and I'm going to print it up, and I'm going to attach it to this document. No, it should be something that was actually used in the classroom. Okay. Cool. Also, the sexual education notification form that was sent home to parents or guardians. This should be a letter that was sent out before sex ed was taught in your school, and this will be an opt-out letter. We want to make sure that on the letter we will find the school's letterhead, so it'd be your particular school, as well as the date in which it was sent out. Right? Is there anything else, right? So you want to make sure that that's there. And then the third supporting document will be a student medical information form, and it should be redacted, heavily redacted. So student information form will look something like this. So on the left, this will be something that the parent filled out for their student, a parent or guardian filled out for the student and sent back to the school. This is something that you would have on file. You can go to wherever this is kept, the school nurse, the clerk's office, make a copy of it, and then redact it. So you want to take out any identifying information, any personal identifying information where you could be able to trace this back to that particular student. We want to protect everyone's privacy, so we don't want to send these things out. So you notice the student's name is taken off, the date of birth, the student ID number, the parent's name, all the parents' contact info. What we want to see is at the top, you'll see the student medical information. It'll be the form from this current year. Your school should be on there. The grade will be fine. All the medical information filled out is fine. We want to know that this is actually completed by a community member in your school, and then the date in which it was completed. So if you have any questions about that, please look at the chat. But again, I want to remind, just to protect everyone's privacy, we want to have this information redacted.
You don't need Adobe redaction capability to do that. That is a nice way of doing it, but you can just print out or take the form that was submitted, make a copy of it, Sharpie those things out, and then scan it back in, and that'll work fine.
Okay. Thank you. All right, and so we talked about the people that are on your wellness team and the people that you should be contacting in order to make sure that you're answering the questions correctly on the Healthy CPS survey. So again, I would recommend downloading the survey because it is completed online, but you can print it out. And a great way to do it is to delegate this process. Everyone does a little, no one has to do a lot. For the things that have to do with the medical info, you can go to the school nurse or the case manager. If you want to know about what's going on with the physical education, please see the PE teacher. For sex ed nutrition minutes, contact your health teacher. The notifications that are sent home, you can talk to the person in your main office, that'll be the clerk. Anything about the meal service and promotions that may come up on the survey, you want to talk to your lunchroom staff. The wellness team will be a great place that is in your school to start and having these conversations. And then, of course, you would want to talk to the administration about any of the things that are going on in your school and the policy. Also, please double check with everyone. Sometimes you may not think that something is actually taking place in your school, and it actually is. So you're going to make sure that everyone is on board in this process. So when you're completing the survey, like I said, it's going to be done online. From the printed copy that you have, I recommend you going over that with the wellness team and or the administration. So you can sit down and make sure that all the answers on the survey are correct before you input it online. You want to start off by uploading the documents to the device that you're going to be using to fill out the survey, so that way you're not trying to figure out where this certain item is or having to run around. Just make sure that it's all on your device so you can do it in one sitting. And then again, you want to complete the survey online. There's a link to it here, and the link has been sent out to you as well. Once you do submit it, there will be no going back into it, correct? Like once it's submitted, right? So once it is submitted, it is in the hands of the Office of Student Health and Wellness. So make sure that everything is completed before you submit. Anything about that?
There is an opportunity for you to revisit your survey response if you close out of it before submitting. So you don't have to do it all at one time. If you prefer to work in pieces, then if you log in with your school ID, then you can just fill out a couple of questions, close out of your browser window, and then revisit it later. It's just when you actually submit that you can't go back to your response again. Just wanted to clarify that.
Thank you for that clarification. So a couple common reasons where schools miss the mark. They didn't fill out the survey correctly. You can ask the wrong person for the information. If you want to know how many minutes are actually being offered for physical education, the lunchroom manager may not be the person you want to talk to, right? This is an extreme example, but just putting that out there. So you make sure you want to talk to everyone in the building about their area of expertise. Sometimes you can be unaware of specific requirements. You don't know you're meeting those requirements. Again, review the wellness policies that I pointed out earlier in this presentation. Sometimes your entire school or staff may not be on board with certain policies, like you're not implementing them. You have a couple teachers that are still holding students out of gym for behavior issues. That is something that you would want to acknowledge and then go forward. Like for next year, you'd want to start a plan on how you can have some alternative practices to that. So you may not be able to meet certain criteria this year, but you'll be able to see, you can game plan for how you can do that next year. Sometimes you have the same thing with parents that are not on board because they, despite what the healthy snack and beverage policy says or what healthy celebration says, they want to celebrate their baby's birthday with cupcakes and all kinds of other things. So you're going to have those parents that are going to be resistant to certain types of change. Again, this is an opportunity to do some planning and seeing exactly how you're going to address that. And I also wanted to acknowledge that sometimes the requirements just can be hard to meet. But again, do not be discouraged. Slow motion is better than no motion. If you can keep moving forward, find like that low-hanging fruit that you can complete throughout the school year, accomplish those, and then game plan for the next school year to see what are the next things that you're going to be able to accomplish. And over time, hopefully sooner than later, you'll be able to be fully healthy CPS. Again, to revisit the deadlines, May 1st is for you to be entered into a raffle for $500 for your school. May 10th will be the final day for schools to submit the completed survey. And June 19th is when the Office of Student Health and Wellness is going to be collecting all the Learning Hub data. I would like to recommend, as I'm talking to the wellness champions and administrations, please have the teachers in the school complete all of the requirements before June 19th. If you give them the deadline of June 19th, it might get done on June 19th or thereafter. And you don't want to miss certain criteria because of a few teachers procrastinated and waited too long. I would highly recommend giving a much sooner deadline to complete certain things so that you can go ahead and complete the survey with confidence. Also, the trainings that are offered, these are not just to check boxes. These are important. Like, you want to have your teachers, especially with this now that the weather is changing, you want to have your teachers trained on allergies and what to do. You want to know where the EpiPens are in the school, because we're going to have kids outside more. There are going to be things, someone is going to get stung by a bee, and you want to have your staff trained on how to handle those situations. So as much as the criteria that we and CPS is asking you to do, these are real life concerns. So I just wanted to make that abundantly clear. So again, for your own interest, please make sure these things are done for June 19th, and then for the sake of the students, make sure that all your staff are trained on the chronic conditions. And with that, I would like to open it up for any questions that you may have thus far, anything that we covered that you're unclear about, and open up the chat function. So if you have anything, please go ahead and send those my way.
I also wanted to add that just additional tips for filling out the survey correctly. There will be a question at the beginning of the survey that asks which grade levels your school serves. So this refers to the whole school, not just one teacher. So please fill out that part correctly, because every question that appears after that question is based on that original one. So you won't see certain options for grade levels if you don't select them in the first place, which will lead to a lot of missing data and therefore lower achievement than really your school is doing. The second point, which is related to that, is there are some grade level questions that relate to minutes reporting for health education, for example. And so we just wanted to remind you that this is, again, for the whole school, the minutes that, you know, an average of students are receiving at the school, and not necessarily the minutes that an individual teacher who may be responding to the survey has done in the year.
And question here, if someone makes a mistake and submits a wrong answer on the survey, how do they go about correcting that after they have submitted it?
Email oshw@tps.edu.
Awesome. And a question here, during the test taking months, when students are taking tests, is it okay to serve healthy snacks during these test taking periods?
Say it again.
Is it okay to serve healthy snacks during test taking periods?
No outside food. So if it's snacks that you already ordered from our catering menu, that comes from Aramark/Chicago Public Schools, then yes, it is okay to serve snacks from that. But if you are purchasing outside food, or if it's parents bringing outside food, that is against the policy. So yes, no outside food.
Thank you very much. All right, are there any other questions that anyone has? All right, if there are no other questions, we'll be wrapping up shortly. Here is a partner list as you're going forward and you are working on implementing healthy activities into your school. These are a list of partners that are currently partnered with CPS schools. They are vetted, and these are some great contacts that you can have. So if you wanted to increase like the physical activity being offered in your school, or some nutrition education programs, these would be some gardening as well. These would be some great people, great organizations to look into. There is a list of resources as you're creating those healthier environments. We have, here's the Healthy CPS homepage, the CIWP Toolkit that I mentioned earlier. There's the CPS Learn Well Toolkit. Please look into that. Then also there's the alternative to denying physical activity. And then we also have Healthy Schools Campaign Fit to Learn resource page, which have some great ways to incorporate physical activity and nutrition education into your lesson plans. And with that, if you have any questions, please feel free to contact us. Again, I can be reached via email. And these are the contact information for both Sarita and Elizabeth. And I would like to thank you all for attending this webinar, and good luck with the Healthy CPS Survey.